Imagine this for a second. You go for a really beautiful weekend hike in the woods.
Sounds nice.
Right. The weather is perfect. You brush up against some tall grass, and maybe you get a tiny, annoying little bug bite on your ankle.
Which, happens all the time.
Exactly. You don't even think much of it. You wash it off, you just go about your life.
Yeah.
But then, a few weeks later, you fire up the grill, you cook a delicious, juicy cheeseburger for dinner, you go to sleep, and then at 2 a.m., you wake up in full-blown, deathly anaphylactic shock.
Oh, wow.
Your throat is closing, your blood pressure is just plummeting, and your body is violently rejecting the food you have eaten safely your entire life.
It honestly sounds like the premise for a science fiction thriller.
Totally.
Like a microscopic insect bite that secretly rewrites your immune system while you sleep. But the crazy part is, for a rapidly growing number of people, this is a very harsh, very terrifying reality.
It really is. So, welcome to the deep dive. Our mission today is to completely unravel what is, I think, arguably the most bizarre medical mystery of the 21st century.
Oh, without a doubt, alpha-gal syndrome.
Alpha-gal syndrome. To figure out how a simple hike can turn a steak dinner into a lethal threat for you, we are pulling together just a massive stack of source material today.
And the research is fascinating.
It really is. We're looking at extensive case control studies from the American South. We've got comprehensive reviews on tick-borne allergies and some, incredibly precise cellular analyses where scientists are literally watching blood cells react in a test tube.
Which is mind-blowing.
Yeah. And joining me to navigate this incredibly complex web of immunology, oncology, and evolutionary biology is our resident expert.
Thanks for having me. I'm really looking forward to this because chaotic and terrifying as alpha-gal syndrome seems on the surface, there is a profound, almost beautiful underlying biological logic to it.
Right.
Like once you understand the mechanics, the whole mystery just starts to unravel.
Okay, well, I want to start at the absolute foundation then. The name itself, alpha-gal. Because when I hear food allergy, my brain immediately defaults to peanuts or shellfish or dairy. And from what I understand, those are almost always reactions to proteins, right? Your body attacks a peanut protein. So what actually is alpha-gal?
Well, you've hit on the first major anomaly of this whole condition. The vast majority of classical food allergies are driven by an immune response to a specific protein.
Okay.
The immune system is basically trained to hunt proteins. But alpha-gal is entirely different. It's not a protein at all.
Wait, it's not?
No, it's actually a carbohydrate. Specifically, it's a disaccharide sugar. The full biochemical name, if we want to get technical, is galactose alpha 1-3 galactose.
A sugar. So someone with this syndrome is deathly allergic to a sugar. I didn't even know that was biologically possible.
It's rare, but it is possible. And what makes this specific sugar so vital to our whole story today is its location. Alpha-gal is ubiquitous in the animal kingdom.
Meaning it's everywhere.
Exactly. It's present in the cells and tissues of virtually all non-primate mammals.
Okay, so like cows and pigs.
Right. Cows, pigs, sheep, dogs, cats, rabbits, mice. They all naturally produce this sugar. They use it to glycosylate their proteins and lipids, which basically means they physically attach this sugar molecule to their cellular building block.
Like a microscopic coating.
Exactly like a microscopic coating.
But wait, you specifically said non-primate mammals. Are you saying we don't have this sugar coating?
We do not. Humans, along with the great apes and old world monkeys, a group known as the catarrhine primates, we do not produce alpha-gal. We are completely devoid of it.
How does an entire branch of the mammalian family tree just lose a fundamental cellular building block? If every other mammal is producing it, why are we the odd ones out?
It comes down to a really dramatic evolutionary event millions of years ago. So those non-primate mammals possess a functional gene called GGTA1.
GGTA1, okay.
Right. And that gene is the blueprint for an enzyme called alpha-1-3 galactosyltransferase.
It's a mouthful.
It is. But just think of that enzyme as the cellular machine responsible for assembling the alpha-gal sugar. Well, sometime during the evolutionary lineage leading to higher primates, that GGTA1 gene suffered a catastrophic mutation. It was completely inactivated.
So the gene just broke.
Precisely. We actually still carry the remnants of that gene in our human DNA today, but it's what geneticists call a pseudogene.
A pseudogene.
Yeah, it's a broken, non-functional piece of code. The machine doesn't work, so the sugar is never built.
Okay, let's unpack this because I'm picturing this like an ancient software update.
I like that.
Right. So millions of years ago, primates got this genetic patch. They completely uninstalled this specific sugar from our source code. But the rest of the mammalian kingdom, the cows, the pigs, the deer, they never got the update. They're still running the legacy software, just pumping out this sugar on every cell in their bodies.
That is a brilliant way to visualize it. We uninstalled the software, and that software deletion is the foundational setup for this entire disease.
Because it makes it foreign to us.
Exactly. Because we do not produce the sugar on our own cells, our immune system views it as a foreign invader.
Well, the immune system's entire job is to seek out things that aren't us and destroy them.
Right. And the research actually indicates this broken gene provided our ancestors with a massive evolutionary advantage.
Really? How so?
Because we lack alpha-gal, our bodies naturally produce high levels of antibodies against it. Specifically, we produce IgG and IgM antibodies. These are the body's standard, everyday defenders.
Okay.
They constantly patrol the bloodstream looking for this sugar.
Hold on, I'm confused. If we uninstalled the software millions of years ago and we don't produce the sugar, how does our immune system even know what alpha-gal looks like?
That's a great question.
Where are we getting the exposure to build these defense patrols in the first place?
The primary source of exposure is actually living inside you right now.
Gross. What is it?
It's your gut microbiome.
Oh.
Yes, certain commensal bacteria that naturally reside in our intestines actually express alpha-gal on their surfaces. Our immune system interacts with those bacteria, recognizes the alpha-gal as foreign, and constantly churns out those IgG and IgM antibodies to keep the bacterial population in check.
Wow. So we are basically using our own gut bacteria as a sparring partner to train our immune system against this sugar.
That's a perfect analogy, and that training pays off immensely because many highly dangerous ancient pathogens also express alpha-gal on their surfaces.
Like what kind of pathogens?
Things like the parasite that causes Chagas disease, certain Leishmania parasites, and even some enveloped viruses, they are coated in this sugar.
Oh, I see where this is going. By deleting this sugar from our own code, we accidentally gave ourselves a universal built-in alarm system against these ancient plagues.
It is an incredible adaptive immune strategy. And this is the crux of the whole syndrome, this natural life-saving defense mechanism sets the perfect stage for a catastrophic allergic misfire.
Because something changes the nature of the defense. Yeah. But if we've always lacked this sugar, and humans have been hunting and eating mammalian meat for hundreds of thousands of years, why didn't the allergy happen before? Like, why are people only starting to get deathly allergic to a steak recently?
That is the multi-million-dollar question. To understand how that switch gets flipped, we have to look at how this syndrome was actually discovered.
Let's do it.
The story of its discovery is, without exaggeration, one of the most incredible medical detective narratives of the modern era.
The sources outline this beautifully, and the sheer coincidence of it is staggering. So the story starts in two completely different places on two different continents at roughly the same time.
Right.
We'll start on the medical side in the United States, around the year 2007. Take me to the oncology wards in the U.S. South, places like Tennessee and North Carolina. What was going wrong?
So oncologists in that region were administering a relatively new, highly targeted cancer drug called cetuximab.
Cetuximab.
Yeah. It was an innovative treatment being used for squamous cell carcinoma of the head and neck, as well as colorectal cancer.
Serious stuff.
Very serious. These are devastating diseases, and this drug offered a lot of hope. But the doctors ran into a terrifying, inexplicable problem.
I love it.
A shockingly high percentage of their patients in some clinics, up to 22%, were going into severe, immediate anaphylactic shock the moment the drug entered their veins.
22%.
Yeah.
That's not a rare side effect. That's a systemic failure.
It was unprecedented.
But wait, I thought a fundamental rule of immunology is that you have to be exposed to a substance first to develop a true allergy to it.
Yes, sensitization.
Right. You get stung by a bee, your body builds the allergy blueprint, and then the second time you get stung, you have anaphylaxis. How could these patients react to a drug they had never taken before?
You've identified the exact paradox that was keeping these oncologists awake at night. You must be sensitized first. These patients had never seen cetuximab before in their lives, yet their bodies were reacting as if they had a massive pre-existing allergy to it.
And the reaction was immediate.
Immediate and violent.
So they had to halt the treatments, obviously. How do you even begin to solve a medical mystery like that? Do you analyze the chemical makeup of the drug?
They had to look deep into the manufacturing process. It turns out cetuximab is a chimeric monoclonal antibody.
Okay, I'm going to need a translation on that. Chimeric. Like the chimera from Greek mythology. The monster made out of a lion, a goat, and a snake.
Are you saying this cancer drug is a biological mashup?
In a sense, yes. In biotechnology, chimeric means the protein is engineered from the genetic material of two different species.
Okay.
In the case of cetuximab, the antibody was partially human and partially murine.
Murine, meaning mouse.
Mouse.
And mice are mammals, which means mice never got the software update. They're still producing the alpha-gal sugar.
The pieces are clicking into place.
Oh my God.
The murine cell line used to manufacture the cetuximab drug was doing exactly what mammalian cells naturally do. It was glycosylating the antibody with alpha-gal.
So the drug was literally coated in this microscopic sugar. Precisely. And when doctors injected it directly into the human bloodstream, the patient's immune system sounded the absolute highest level of alarm.
But hold on, we established earlier that we all have normal IgG and IgM antibodies against alpha-gal from our gut bacteria.
Right. The everyday defenders.
Yeah. To have an anaphylactic shock, you need a very specific, aggressive type of antibody, right? The IgE antibodies.
Yes. IgE immunoglobulin E is the antibody responsible for severe allergic reactions.
Oh.
And that was the missing puzzle piece the researchers uncovered.
Okay.
These specific patients in the South didn't just have normal IgE defenders. For some completely unknown reason, their immune systems had switched gears. They had developed extremely high levels of IgE antibodies specifically targeted at the alpha-gal sugar.
So they were already highly allergic to the sugar before they ever walked into the oncology ward.
They were walking around with a loaded allergic weapon, and the cancer drug was simply the trigger.
Wow.
But nobody knew why they had developed this IgE allergy in the first place.
Okay, let's keep that mystery pinned. Because meanwhile, halfway across the globe in Australia, a totally different clinical observation is taking place.
Yes. A clinical immunologist and allergy specialist in Sydney, Dr. Cheryl Van Noonen, was observing a highly unusual pattern in her clinic.
What was she seeing?
She had a cluster of patients presenting with severe, newly developed allergic reactions to red meat.
Which, as we know, is packed with alpha-gal.
Exactly. But Dr. Van Noonen noticed a crucial common denominator among these specific patients. Before they developed the meat allergy, every single one of them reported experiencing unusually large, highly reactive tick bites.
A tick bite. Okay, so we have oncologists in North Carolina dealing with a cancer drug allergy, and an allergist in Sydney dealing with meat allergies following tick bites.
Yeah.
How do these two completely disparate phenomena finally collide?
It all came down to a map. The researchers investigating the cetuximab reactions decided to map out exactly where these adverse events were occurring across the United States.
Did they assume it would be random?
They assumed it would be random or maybe tied to specific hospital protocols, but the map showed a striking geographic clustering.
Where was it?
The reactions weren't happening in Boston or Seattle or San Francisco. They were heavily concentrated in the Southeast, North Carolina, Tennessee, Arkansas, Missouri.
That is incredibly specific for a drug reaction.
It was so specific that they brought in epidemiologists, and someone looked at that heat map of hospital reactions and realized they had seen that exact shape before.
You're kidding.
They pulled up an entomological map showing the known geographic distribution of various tick species in the U.S.
Oh my gosh.
When they overlaid the cancer drug reaction map onto the tick map, it was a near-perfect match for the territory of Amblyomma americanum, the Lone Star tick.
I want to make sure I'm visualizing this correctly. The map of where patients were going into shock from an IV cancer drug was the exact same shape as the map of where a specific species of bug lives in the woods.
Yes.
That is a staggering medical discovery.
It is a phenomenal piece of epidemiological detective work. The researchers realized that both the cancer drug and the mammalian meat contain the exact same alpha-gal sugar.
And the tick bite is the environmental trigger.
Right. The tick is the missing link that forces the immune system to abandon its normal, quiet defense, those IgG and IgM antibodies, and start churning out allergic IgE antibodies.
I am still struggling to wrap my head around the mechanics of this. A tick bites you on the ankle. It introduces a microscopic amount of its saliva into your skin, and your body responds by fundamentally altering its relationship with a food you've eaten safely for decades. It just feels disproportionate.
It is an extreme immunological pivot, I agree. But the sources provide incredibly robust, undeniable data to back this mechanism up. Look at the case control study conducted by Kirsch and colleagues from the CDC and the University of North Carolina.
Right. They designed a study to definitively evaluate tick exposure as the primary risk factor for alpha-gal syndrome.
Yes.
The numbers in this study are wild. What did they find when they actually sat down and compared patients with confirmed alpha-gal syndrome to healthy people from the exact same neighborhoods?
Well, they conducted detailed interviews about the participants' history with ticks in the year prior to the onset of their symptoms. The results were overwhelming.
Let's hear it.
Patients with AGS were 11 times more likely to recall finding a tick attached to their body compared to the control group.
11 times. But to be fair, if you live in rural North Carolina or Tennessee, almost everyone gets a tick on them eventually. Did the study find a difference in the severity of the exposure?
It absolutely did. The data revealed a very clear dose-response relationship. It wasn't just about a single casual brush with a tick.
Okay.
AGS patients were a staggering 33 times more likely to report having 4 or more embedded ticks compared to healthy controls.
33 times. So we're talking about significant repeated exposure to these parasites.
And beyond the sheer volume of ticks, the study highlighted a crucial detail about the nature of the bites themselves. The researchers found that AGS patients were nearly 8 times more likely to report that the tick bite created a severe localized reaction.
What does that look like?
They described long-lasting red marks, severe, persistent itching, or a rash that took an unusually long time to heal.
So the bite isn't just a tiny puncture wound. It's acting like an angry, inflamed inoculation site. It's red. It's itchy for weeks. That tells me the immune system is actively waging a war right there in the tissue of the skin.
Your intuition is entirely correct. Tick saliva is not just water. It is an incredibly complex, highly evolved pharmacological cocktail.
Because it wants to feed without you noticing.
Exactly. When a tick attaches, it needs to feed on your blood for several days without you feeling it and without your blood clotting.
Wow.
To achieve this, it injects vasodilators to open the blood vessels, anesthetics to numb the pain, and anticoagulants to keep the blood flowing.
It's essentially a microscopic chemical warfare unit.
It really is. And hidden within that complex mixture of proteins and lipids we now know are glycoproteins and glycolipids carrying the alpha-gal sugar.
So the tick is delivering the sugar directly into the battlefield.
Yes. When that saliva is injected into the dermis, which is packed with immune surveillance cells, particularly dendritic cells and mast cells, it creates a highly specific inflammatory environment.
Okay.
The immune system is already primed to view alpha-gal as foreign. But when the sugar is presented alongside all the disruptive immune-modulating proteins in the tick saliva, it confuses the immune system.
Phoenix.
It forces the immune response down what we call a Th2 pathway. And the Th2 pathway is the specific immunological route that generates IgE allergy antibodies.
So the tick saliva is basically tricking the immune system into classifying this sugar not as a manageable background threat, but as a severe allergen.
Exactly.
And I want to clarify for everyone listening, this is not just a problem for hikers in the American South, right? The sources make it clear this is not an isolated geographic anomaly.
No, this is a global phenomenon driven by different regional tick species that have evolved similar salivary mechanisms.
Right.
In the United States, the primary culprit is the Lone Star tick. But in Australia, the disease is driven by the paralysis tick, Ixodes holocyclus.
Okay.
In Europe, researchers have linked the syndrome to Ixodes ricinus, the castor bean tick. In Brazil and parts of South America, it's Amblyomma sculptum.
Wow.
Even in Japan, cases are tied to Haemaphysalis longicornis. Wherever you have ticks feeding on mammals, picking up the alpha-gal, and then subsequently biting humans, we are seeing clusters of alpha-gal syndrome emerge.
Okay, this is fascinating, but I need to push back on something from that Kirsch study.
Sure.
You mentioned the control group. The healthy people from North Carolina who happily ate hamburgers every weekend with zero issues.
No.
Did the researchers test their blood? Did any of them have these allergic IgE antibodies?
The researchers did test them, and this reveals a vital nuance about how allergies actually work. Yes, they did find antibodies.
They did.
In the Kirsch study, roughly 33% of the control group tested positive for alpha-gal IgE antibodies.
Hold on, stop. You were telling me that 1 in 3 healthy people in that study had the allergy blueprint in their blood, but they can eat a steak with absolutely no problem.
That's right.
Doesn't that mean the test is fundamentally broken? The whole concept of a blood test seems useless if a third of the population is walking around with a false positive.
It is not a false positive. The antibodies are genuinely there. What you are touching on is the critical clinical distinction between being sensitized and actually having a clinical syndrome.
Explain the difference to me because they sound identical.
Sensitization simply means your immune system has manufactured the IgE antibodies. You have the blueprint for the allergy stored in your biological library.
Okay.
But having the syndrome means those antibodies are actively binding to your mast cells, triggering them to degranulate, release massive amounts of histamine, and cause physical symptoms when you are exposed to the trigger.
So it's like having a loaded gun in your house, but the safety is permanently on.
Yeah.
You are technically sensitized, the ammunition is there, the potential for disaster is real, but until some unknown biological mechanism actually pulls the trigger, you don't experience the allergy.
That is an excellent analogy. Many individuals, particularly those with lower titers, meaning lower concentrations of the IgE antibody, can remain completely asymptomatic for their entire lives.
That's wild.
They can routinely consume mammalian meat without ever experiencing a hive, but they carry that underlying risk.
Okay, so let's talk about what happens when the safety does come off. When someone who have the full-blown syndrome, the loaded gun with the safety off, actually sits down and eats a piece of mammalian meat.
Right.
Because this brings us to another completely baffling, rule-breaking aspect of this disease, the timing.
The timing is what makes alpha-gal syndrome entirely unique in the landscape of food allergies.
Right, because if I have a friend with a severe peanut allergy and they accidentally eat a cookie with peanut dust in it, we are stabbing them with an EpiPen within 3 minutes.
Absolutely.
Their lips swell instantly, their throat closes. It is an immediate emergency.
But with alpha-gal, that's not what happens at all.
Not at all. Standard IgE-mediated food allergies trigger rapid degranulation of mast cells. The allergenic protein hits the mucosal lining of the mouth and the stomach. The immune system recognizes it instantly, and the reaction cascades within minutes.
Okay.
But AGS is famously dangerously delayed. The onset of symptoms typically does not begin until 2 to 6 hours after ingesting the meat.
2 to 6 hours. That makes no logical sense. If the cancer drug cetuximab caused immediate, terrifying anaphylaxis the second it was injected into the vein, why does a cheeseburger take 4 to 6 hours to cause the exact same reaction?
To understand the delay, we have to explore what researchers call the glycolipid hypothesis.
Okay, let's hear it.
Remember our earlier discussion. Alpha-gal is a sugar. But in mammalian meat, this sugar does not just float around freely in the cellular fluid. It is primarily attached to lipids, meaning fats.
Oh, fats.
Yes.
Yep.
It forms the combined molecule called a glycolipid. Okay, so the sugar molecule is physically anchored to a fat molecule inside the steak.
Yes. Now, think about how the human digestive system processes different macronutrients. Proteins and carbohydrates are broken down relatively quickly in the stomach and early intestines.
Right.
They're absorbed efficiently into the portal vein and sent straight to the liver for immediate processing. That is a biological fast track.
Okay, that makes sense.
But fats lipids are digested through an entirely different, incredibly convoluted pathway.
I am going to try and build an analogy here because the lipid digestion pathway is wild.
Please do.
If you inject alpha-gal straight into the blood via an IV cancer drug, the sugar is taking the express train. It has immediate, unfiltered access to the bloodstream. It encounters the mast cells instantly, and you get an immediate allergic reaction.
Spot on.
But if you eat that same sugar attached to a fat molecule in a burger, it is forced to take a slow, cumbersome cargo shipping route.
The cargo ship analogy is actually highly accurate. Walk me through the shipping route.
Okay, so you chew and swallow the burger. It hits your stomach, but fat doesn't dissolve in water, so your body has to work hard to break it down.
Right.
It travels to your small intestine, where your gallbladder squirts bile salts onto it to emulsify it, breaking the big fat globs into tiny droplets called micelles.
Correct. The physical breakdown.
Then, the cells lining your intestinal wall absorb these tiny fat droplets. But they can't just dump raw fat into your blood.
No, they can't.
So the intestinal cells package the fat into these massive, bulky cellular cargo ships called chylomicrons.
And those chylomicrons are packed with the alpha-gal glycolipids.
Right. But here's the crazy part. These chylomicron cargo ships are physically too large to squeeze into the tiny capillaries of the bloodstream.
Yep.
So they had to be routed into the lymphatic system instead. They slowly travel up this biological highway called the thoracic duct, which completely bypasses the liver, and finally, hours later, the lymphatic system dumps these massive cargo ships into the systemic blood circulation up near your collarbone.
You have beautifully described the lymphatic transit of dietary lipids.
Yikes.
But even once the cargo ships enter the bloodstream, the journey isn't over. Those massive chylomicrons have to circulate through the body and be progressively broken down by enzymes in the blood.
By getting unpacked.
Exactly. They shrink down into very low-density lipoproteins, or VLDL, and eventually, after more enzymatic processing, they become low-density lipoproteins, LDL.
LDL, the infamous bad cholesterol particles that doctors are always warning us about.
Exactly. And the physical size of the particle is the key to the entire mystery. It is only when these fat packages are enzymatically whittled down to the size of an LDL particle that they are physically small enough to pass through the endothelial walls, the lining of the blood vessels, and enter the interstitial tissues of the body.
And why is reaching the interstitial tissues so important for the allergy?
Because the interstitial tissue is where the mast cells live. Mast cells are the immune cells equipped with the IgE receptors. They are the alarm bells of the allergic system. So the alpha-gal sugar, because it is hitched to a fat molecule, has to survive this entire multi-hour convoluted journey: stomach digestion, bile emulsification, intestinal packaging into chylomicrons, slow lymphatic transit dumping into the blood, and hours of enzymatic shrinking before it finally physically reaches the mast cells waiting in the tissues.
And that is why it takes 4 to 6 hours.
Yeah.
It's not a delayed reaction. It's a delayed delivery. It's a biological slow-motion train wreck.
It is a profound mechanical delay. And this biological reality is exactly why alpha-gal syndrome is so incredibly difficult for both patients and doctors to diagnose. From a human behavioral perspective, the cause and effect relationship is completely severed.
I can't even imagine the psychological toll that takes. You go out for a celebratory steak dinner at 7 p.m., you feel great, you go home, you watch some TV, you fall deeply asleep.
Yeah.
Then at 2 a.m., you wake up covered in agonizing hives, your throat is tightening, your blood pressure is plummeting, and you are in a fight for your life. Your brain is absolutely not going to blame the dinner you ate 7 hours ago.
It defies human logic. Most patients naturally blame something they encountered in the minutes right before the attack.
Like what?
They tell their doctors they must be allergic to a new laundry detergent, or they insist a spider bit them in their sleep, or they blame a glass of water or a medication they took right before bed.
Wow.
And for years, medical professionals were equally baffled because, according to standard medical textbooks, delayed anaphylaxis to food simply wasn't supposed to exist.
It violates all the established rules of allergy testing.
Yeah.
And speaking of violating rules, the symptoms themselves aren't always what we expect.
True.
We usually associate food allergies with hives, swelling, and anaphylaxis. But the sources highlight that there are some really insidious, hidden dangers of alpha-gal that go far beyond an itchy rash. Let's talk about the gastrointestinal symptoms.
This is a major evolving area of recognition in the field. AGS is increasingly identified as a cause of isolated gastrointestinal morbidity.
What does that mean in plain English?
What that means is some patients never experience the classic allergic signs. They never get a single hive, their lips never swell, they never have shortness of breath. Their only symptom is severe, agonizing abdominal pain, intense cramping, nausea, and explosive diarrhea, reliably starting a few hours after a meal.
That sounds like an absolute diagnostic nightmare, because if you show up to an emergency room or a gastroenterologist with severe abdominal cramps and diarrhea, their mind is not going to jump to tick-borne meat allergy.
Not at all.
They're going to think you have food poisoning or irritable bowel syndrome or maybe Crohn's disease.
The misdiagnosis rate for the GI variant of this disease is tragically high. Many patients suffer for years. They undergo invasive, painful endoscopies. They are prescribed heavy immunosuppressant medications for assumed inflammatory bowel disease simply because their allergy presents entirely within the gut.
That's heartbreaking. So why does it happen just in the gut?
The leading theory is that the alpha-gal glycolipids interact directly with the high concentration of mast cells localized in the intestinal mucosal lining. This causes intense localized inflammation and smooth muscle contraction in the gut, rather than a systemic shock throughout the body.
So the allergic war is being fought entirely in their intestines. That is brutal.
Yeah.
But as terrible as the GI issues are, there is an even more startling finding hidden in the Wilson and Platzmills paper.
Yes.
Something that could have massive, terrifying public health implications. Let's talk about the impact of alpha-gal on the human heart.
Yes. This is perhaps the most critical ongoing research regarding this syndrome. Researchers began to notice an alarming correlation between patients who were sensitized to alpha-gal and an increased risk of severe cardiovascular disease.
In what way?
Specifically, imaging studies revealed that having IgE antibodies to alpha-gal is heavily associated with increased atheroma volume, meaning a larger buildup of dangerous plaque in the arteries.
Plaque buildup is bad enough, but the papers specify the nature of these plaques.
Right. Crucially, yes. The presence of alpha-gal antibodies is associated with plaques that have highly unstable characteristics.
And just to clarify the cardiology here, unstable plaques are the fragile ones. They're the ones that are prone to rupturing suddenly, causing a massive blood clot, which leads to an immediate, often fatal heart attack.
Exactly. Unstable plaques are highly inflammatory and dangerous.
So how is the allergy causing this?
The working hypothesis is profound. Every single time a sensitized individual eats mammalian meat, even if they don't have an overt, noticeable allergic reaction like hives or a stomachache, they are triggering a low-level, silent, chronic inflammatory response inside their blood vessels.
Wow.
As those alpha-gal-coated LDL particles we talked about earlier circulate through the bloodstream, the immune system constantly attacks them, driving inflammation directly into the arterial walls.
I am genuinely terrified by the implications of this. Remember earlier when I pushed back on the curse study?
Yeah, the 33%.
Right. The fact that 33% of the control group, the people who felt perfectly healthy, were sensitized with the allergic blueprint, but had no visible symptoms.
I see where you're going with this.
Are you telling me that those people who think they are perfectly fine eating a double bacon cheeseburger every weekend could actually be suffering silent, chronic, escalating cardiovascular damage every time they eat?
That is the exact chilling question the leading researchers are trying to definitively answer right now. Can a diet, including mammalian products, contribute to atherosclerosis and heart attacks in individuals with IgE to alpha-gal who are completely unaware of their allergic status?
That's a scary thought.
We don't have the final definitive longitudinal data yet, but the preliminary mechanistic links strongly suggest that this specific allergic sensitization is a silent driver of inflammatory heart disease.
That fundamentally rewrites how we have to view this syndrome. It is not just an acute, obvious food allergy. It is potentially a silent, chronic disease driver affecting millions of people who have no idea they are sick.
It's a major paradigm shift.
And the really tricky part is, avoiding alpha-gal isn't just a matter of saying no thank you to a steak or a pork chop at a barbecue. The sources list an absolutely alarming number of hidden sources of this sugar.
Because alpha-gal is expressed by the cells of all non-primate mammals, any product derived from the tissue, bone, or fluids of those animals can potentially contain the sugar and trigger a reaction.
Let's run through some of these because they are everywhere. We're talking about dairy, right? Milk, cheese, yogurt, butter.
Yes, although it's important to note that dairy generally contains much lower concentrations of alpha-gal than muscle meat or visceral organs.
Okay, that's somewhat relieving.
Yeah, many AGS patients can actually tolerate dairy, but some highly sensitive individuals definitely react to it and have to strictly avoid all milk products.
Okay, dairy makes sense. But what about gelatin? Gelatin is in everything. Gummy bears, marshmallows, Jell-O.
It is.
And it's not just candy. What about the capsules of medications? Hundreds of over-the-counter pain relievers and prescription drugs come in those soft or hard gel capsules.
Gelatin is highly problematic. It is almost always manufactured by boiling down porcine or bovine collagen, the skin, tendons, and bones of pigs and cows.
Makes.
It is a concentrated source of alpha-gal. We have seen numerous case reports of severe anaphylaxis triggered simply by a patient swallowing a gel-capped medication.
Just a pill.
Just a pill. We've even seen severe reactions to common vaccines that use gelatin as a thermal stabilizer, such as the zoster vaccine for shingles.
But the medical exposures get even more direct and, frankly, more dangerous than a vaccine stabilizer. You mentioned heparin earlier in our notes. What is the danger there?
Heparin is a crucial, widely used intravenous blood thinner. It is administered constantly in hospitals, especially during cardiovascular surgeries, dialysis, or to treat severe blood clots.
Right.
The vast majority of pharmaceutical heparin is derived directly from porcine intestinal mucosa, pig guts.
Oh, no.
Yes, it is incredibly rich in the alpha-gal sugar.
So if you give that to a patient,
injecting a massive dose of porcine heparin directly into the bloodstream of a highly sensitized alpha-gal patient can cause catastrophic, immediate intraoperative anaphylaxis while the patient is open on the surgical table.
That is a surgeon's worst nightmare.
Absolutely.
And what about physical medical implants?
Oh.
If someone's heart is failing and they need a valve replacement, surgeons often use bioprosthetic valves instead of mechanical ones.
Which are frequently manufactured from bovine pericardium or porcine aortic valves. Cows and pigs.
Right.
There are documented peer-reviewed cases of premature bioprosthetic aortic valve degeneration in patients who had an underlying unrecognized alpha-gal allergy.
Their immune system was silently, continuously attacking the new heart valve because it was coated in the sugar.
Exactly. The immune system recognized the valve as a massive foreign body covered in the allergen, mounted an inflammatory attack, and destroyed the structural integrity of the valve years before it should have failed.
That is incredible. So we have a disease with massive hidden dangers, vague GI symptoms that mimic other diseases, a bizarre 4 to 6 hour delay, and the potential for silent heart damage.
It's a lot.
With all of that chaos, how on earth do doctors actually definitively prove a patient has alpha-gal syndrome? Like, if I go to my allergist tomorrow and say, I think I have this, can they just do one of those standard skin prick tests on my back?
They can certainly try, but the Eberlein study we reviewed highlights exactly why standard skin prick tests can be highly unreliable and often falsely negative for alpha-gal syndrome.
Why would a skin test fail? If I have the allergy and you literally prick my skin with a needle covered in beef extract, shouldn't the mast cells in my skin react immediately and form a big red bump?
You would logically think so, but you have to look at how those testing extracts are manufactured. The commercial extracts used in allergist offices for standard skin tests are primarily aqueous.
Meaning they're water-based.
Right, they are water-based solutions. Aqueous extracts are fantastic for isolating and delivering water-soluble proteins. If you are testing for a peanut protein or a pollen protein, a water-based extract works perfectly. But remember the biology we discussed. The alpha-gal that causes the severe delayed reaction is primarily a glycolipid. It is a fat-soluble molecule.
I see it. Fat and water don't mix.
Exactly.
So the standard water-based allergy test extract might not even contain enough of the actual sugar-fat combination to trigger a reaction on the skin.
Precisely. The glycolipids are often left behind during the water extraction process. Or the concentration that makes it into the vial is simply too low to consistently elicit a reliable wheel and flare immune response on the skin.
That's a huge flaw.
It is. A patient could have severe AGS, get a skin test, see no reaction, and be told they are fine to eat meat.
Wow.
To avoid this dangerous misdiagnosis and separate true clinical AGS from mere asymptomatic sensitization, leading scientists have turned to a much more sophisticated, highly precise cellular assay called a basophil activation test, or BAT.
Let's demystify this test because the mechanics of it are fascinating. First, what exactly is a basophil, and how does taking my blood help diagnose a delayed fat allergy?
Basophils are a specific type of white blood cell. They are very closely related to mast cells. They circulate continuously in your bloodstream, and crucially, they carry the exact same IgE antibodies on their outer surface that your tissue-bound mast cells do.
Okay.
They are basically the circulating, floating sentinels of your allergic immune system.
So instead of trying to force a water-based extract into the mast cells in my skin, the doctor just draws a vial of my blood, which is full of these floating sentinel cells.
Yes. They take your fresh blood, which contains your living basophils armed with your specific biological blueprint.
Right.
Then, in the controlled environment of a test tube, the laboratory scientists deliberately expose those cells to various concentrated alpha-gal allergens.
And then what?
If your basophils recognize the alpha-gal as a threat, they activate, just as they would in your body during anaphylaxis.
But how can a scientist peering into a test tube tell if a microscopic white blood cell is activated? Do the cells change color? Do they explode?
They don't explode, but they do undergo a dramatic physical transformation. When a basophil activates and degranulates, it physically reorganizes its internal structure.
Like transforming.
Yeah. It takes certain proteins that are normally hidden deep inside the cell and pushes them out to the external cellular membrane. One of the most important of these proteins is a marker called CD63.
Okay, so the activated cell puts a specific protein flag on its roof. How do they see the flag?
They use a brilliant piece of technology called flow cytometry.
Flow cytometry.
Right. The scientists introduce special fluorescent chemical markers into the tube that are designed to physically attach only to the CD63 protein flags.
Whoa, that is so cool.
Then they run the blood cells single file through a machine that shoots highly calibrated lasers at them.
Lasers. Okay.
If the laser hits a cell and it glows brightly with that fluorescent marker, the machine registers it as an activated cell. If they see a high percentage of basophils glowing, they know definitively that the cells degranulated upon exposure to the meat. The allergy is real and severe.
That is sci-fi level diagnostics.
It's real.
Shooting lasers at glowing protein flags. But the Eberlein study didn't just use one type of meat in these test tubes. They tested a few different things.
They did.
They tried commercially synthesized pure alpha-gal proteins. But the thing that triggered the basophils, the absolute best, the ultimate undeniable stress test for this allergy, was a solution made of pork kidney extract.
That's right.
Why a pork kidney? Why not just blend up a piece of bacon or a high-fat ribeye steak?
This comes down to a fascinating quirk of mammalian biochemistry. Think about what a kidney actually does in a living animal.
It filters blood.
Right. It is a massive, highly complex biological filter. It is constantly processing enormous volumes of blood, filtering waste, and regulating electrolytes. It is densely packed with highly active cells, intricate vascular networks, and functional glycoproteins.
Okay, let me translate this. Because the kidney is so metabolically active and doing so much heavy lifting, its cells need massive amounts of those sugar building blocks on their walls to function, compared to a lazy piece of structural muscle tissue like bacon.
That is exactly right. Visceral organs, the kidneys, the liver, the heart, the intestines, have exponentially higher concentrations of alpha-gal epitopes on their cellular surfaces than skeletal muscle meat.
So, to use an analogy, if exposing your blood to a pork chop is like throwing a firecracker at the immune system, exposing it to a pork kidney extract is like dropping a stick of dynamite.
A microscopic sugar bomb.
Exactly.
And the Eberlein study found that exposing a patient's blood to this specific, highly concentrated pork kidney extract yielded 100% specificity in their testing cohort.
100%.
If the basophils reacted strongly to the kidney extract and lit up under the lasers, it was a definitive, undeniable confirmation that the patient had clinical alpha-gal syndrome and was not simply carrying asymptomatic antibodies.
That is clinical precision at its absolute finest. We have covered an immense, complex landscape today, and before we wrap up, I want to take a moment to just synthesize this incredible journey for you listening, because when you string it all together, it sounds like an impossibility.
The biological cascade really is astounding when viewed from start to finish.
It is. So you go for a walk in the woods, a tick, likely the Lone Star tick, bites you. It needs to feed for days, so it covertly injects a complex pharmacological cocktail of saliva into your skin.
Right.
Hidden within that numbing, anti-clotting saliva is a specific sugar galactose alpha 1-galactose that your evolutionary ancestors explicitly deleted from your genetic code millions of years ago.
The old software.
Exactly. Your immune system, which has already been trained by your own gut bacteria to view this sugar as a threat, gets totally confused by the inflammatory tick saliva. Instead of a normal defense, it mounts a massive, inappropriate IgE allergic response.
And then that silent, volatile blueprint simply sits in your body, waiting.
Right. Months later, you eat a burger. The meat is packed with this same sugar, but it's attached to fat molecules. Your digestive system painstakingly breaks down the fat, packages it into massive chylomicron cargo ships, routes it entirely around your liver through your lymphatic system, and finally dumps it into your bloodstream.
Such a long journey.
4 to 6 hours later, those fat particles shrink down to LDLs, slip through the walls of your blood vessels into your tissues, and set off the mast cell alarm bells. You wake up in anaphylaxis, completely rejecting a food source that sustained human evolution.
It is a profound, humbling demonstration of how deeply physically interconnected our bodies are with the external environment.
And speaking of our relationship with the environment, I want to leave you with a final provocative thought. Something from the Platts-Mills paper that really stopped me in my tracks and reframed this entire disease for me.
I suspect you are going to bring up the ecological data.
I am. We asked earlier, why is this happening now? Why wasn't alpha-gal syndrome a massive, recognized public health crisis in 1950 or 1920?
It's a great question.
The Platts-Mills paper notes a crucial, undeniable ecological fact. The primary reproductive host for the adult lone star, tick the animal it relies on to breed and spread, is the white-tailed deer.
Right.
And the population of white-tailed deer in the United States has absolutely exploded since 1980.
The population growth is staggering, going from barely a million a century ago to over 30 million today.
Wow.
And it's vital to recognize that this is not a random natural fluctuation in wildlife numbers. It is almost entirely due to intentional and unintentional human-driven environmental changes.
We engineered the perfect deer habitat. We built massive, sprawling suburbs. We cut down dense forests and replaced them with lush, manicured lawns, golf courses, and azalea bushes, which is essentially a buffet for deer.
It is.
At the exact same time, we systematically hunted and eliminated almost all of their natural apex predators from those areas. There are no wolves, no cougars hunting in the suburbs of North Carolina or Long Island. We created a protected, infinite food source for the primary host of this tick.
So the deer population booms exponentially. The tick population subsequently booms alongside them. The ticks expand their geographic territory into our backyards, and human exposure to tick bites skyrockets.
Exactly. We often think of climate change and environmental disruption as abstract concepts, things that happen around us. A melting glacier, a changing weather pattern, a dying coral reef.
Right, something far away.
But alpha-gal syndrome proves that altering our local ecosystems, like letting deer populations explode in our neighborhoods because we wanted nice lawns, and no wolves can literally reach inside our bodies, rewrite our cellular immune systems, and dictate what we can safely put on our dinner plates. Are we unknowingly engineering our own food allergies?
It's a sobering, critical question for the future. It demonstrates perfectly that human health and ecological health are not two separate, isolated disciplines. They're the exact same thing.
Wow.
And when you dramatically disrupt the balance of the ecosystem, you inevitably disrupt the balance of human biology.
The picture is so much larger and so much more complex than we ever realized. Thank you so much for joining us on this deep dive.
My pleasure.
Keep questioning the world around you. Always check for ticks, and we will see you next time.